Even as health authorities continue to push the envelope to ensure between 60 to 80% of the local adult population is immunized against COVID-19 in a timely manner, 3 months into the vaccination drive, which started on February 11th, more than 154,000 adults have been inoculated. Health authorities have indicated that an estimated 500,000 adults are eligible for vaccination across the country. However, achieving herd immunity would necessitate 350,000 adults being fully vaccinated. The potential end to COVID-19, which is anticipated to drastically reduce transmission, is referred to as herd immunity. This happens when a significant portion of a population achieves immunity to a disease, either through prior infection or vaccination, so that the disease is unable to spread from person to person. Based on the plan to immunize 70% of the adult population, Head of Medical Services and Cardiology at the Georgetown Public Hospital, Dr. Mahindra Karpan, in a recent interview with Nightly News, divulged that herd immunity is likely within the next quarter of this year.
Then that's 350,000 Guyanese or residents. So we're at 150. We need to vaccinate 200,000 more. It took us from March to May to do 150. So that is 2.5 months, maybe in another 3 to 4 months.
With the emergence of a COVID-19 variant in neighboring Brazil, which has made its way to Trinidad and Tobago, many Guyanese are worried whether the country will face the same fate. Dr. Karpan was asked whether any of the COVID-19 vaccines currently being used locally offer protection against the new variant.
The basic mechanism in which the vaccines work to reduce severity of illness continues to work even in the Brazilian variant. The countries that have been showing the catastrophic events of the second wave, there is a failure there for vaccinating the population rather than the failure of vaccines.
Brazil's P1 COVID-19 variant is behind a deadly COVID-19 surge in that country as well as Trinidad. It is considered to be a more highly transmissible and deadlier form of the virus. While health officials have not completely rubbished claims of the presence of the P1 variant in Guyana, they seem hesitant in confirming it. Instead, they are adamant that until samples are sent abroad for testing and the results confirm the existence of the mutant strain, the claims will be considered speculations. In a 24-hour period over the weekend, Trinidad recorded 8 deaths and Guyana 9. And given the sudden rise in new infections and deaths in both countries, and the fact that Guyana's airports remain open to all and sundry, it is impossible that the variant has escaped Guyana. Numerous, continuous, and growing calls from all sections of society for the government to reinstate the 6 p.m. to 6 a.m. curfew until the situation is brought under control continue to fall on deaf ears. Instead, as the body count spirals, vaccination seems to be the myopic solution for this administration. A second COVID-19 tsunami is also wreaking havoc in India, which has disrupted the manufacture of COVID-19 vaccines. Dr. Karpan took the opportunity to urge persons to avoid procrastinating to take the jabs, as there is possibility that a massive shortage will emerge.
There are many people in Guyana and around the world who may want to wait a little bit more before getting their vaccines. And I want to caution a little bit because we see what's happening in India. And a lot of the vaccines, a lot of the vaccine components, even for the Pfizer vaccine and Moderna vaccine, they are produced in India. And if India becomes overrun and they're unable to supply the world with medicines and vaccines, etc., then it will become scarce.
Temika Rodney reporting for the HGP Nightly News.